Hello, and welcome to part 2 of the medical advocacy training. In this portion, we will be going over what is a safe exam, what a safe exam looks like, and what is in a safe kit. A safe exam is a complete medical, psychological, and forensic exam. They are typically performed up to 120 hours after the assault, but there are exceptions to this timeline. An exam typically takes a few hours and is very invasive. It is important to remember that the patient can at any time refuse any part of the exam. They are always in control. During the course of the exam, there will be several options that are available to the survivor on how to proceed. They can choose to have a full exam, which includes the medical forensic exam and kit collection with report to law enforcement. They can also choose to have this done without reporting to law enforcement, and this is known as an anonymous kit collection. We will discuss this in a later segment. Another option available is medical treatment only. This would be medical treatment including for prophylaxis, but will not include kit collection. There is also the option to report or not to report, and may be the only option available depending on the timeline. The final option is a report only. This is very rare, and I've never personally seen this, but it could happen. So what can you expect during a safe exam? I'm going to kind of talk through my process, and most examiners tend to follow this typical process, but note that they're always tailored to meet the individual needs of every survivor. And at any point in time, they may be adjusted depending on the needs of the survivor that is presented. But typically, it starts with a complete medical history. This is benign information that's usually pretty easy for the survivor to talk about. This is an excellent opportunity for rapport building. This is the point where we're talking about their past medical history, allergies to medication, last menstrual period, and things like this. From there, we move into the assault history. This is where it's getting a little bit more invasive and a little harder to talk about. But this is a very important piece of this exam, as it will help gear the forensic portion of the exam. This will help me know where to look for potential evidence, what kind of evidence I may expect to find. These are where I'm going to collect specimens from, and to know if I am within the timeline for evidence collection. Forensic photography is a portion of this exam, although presently in Spokane County, nurses are not doing forensic photography. This is something that is being worked on, but at this point in time, nurses are not taking photographs. Blood or urine testing is indicated. There's two portions of this. There is the collection that is to go to the state crime lab. This is typically utilized in drug-facilitated sexual assault or suspected drug-facilitated sexual assault. These specimens are collected and then packaged and sealed and sent to the state crime lab following chain of custody. However, there may be things that are collected for the hospital use, such as STI or pregnancy testing. The rest of the stuff we will discuss in later segments. A safe kit, or SAK, is a basic term for the evidence collection kit. Kits may vary from state to state, but the general contents are typically pretty similar. They consist of swabs, envelopes, instructions, comb, and other various tools. We do have kits in office, and you are more than welcome to look through them. The envelopes will have the specimen that is to be collected and placed within that envelope. On the front of it will also include instructions on how to go about obtaining that specimen. The back side of the envelope will have the information as for the survivor and where the specimen was collected from, and potentially what you're looking for there. Once collected, the evidence is packaged, sealed, and returned to the kit. The kit is then sealed and submitted to law enforcement with any other evidence that was collected, including clothing or the drug-facilitated sexual assault evidence